My name is Brittany Marshall, and this is my newborn assessment. I will ensure to maintain patient safety, privacy, and dignity throughout the exam. As this is a newborn, we need to make sure that that the baby stays warm. I will communicate using age-appropriate approach and sequences, and I will be sure to introduce myself to the parents if the parents are present. With a newborn, you need to make sure that you know the birth history. Was it vaginal? Was it C-section? Were there any complications at birth? Anything that you need to specifically be looking out for. Vital signs have already been established to be normal. Temp, pulse, and respiratory rate were within normal limits. We've done length, marked head to toe, making sure that we stretch out the baby. We've already done weight, as the scale bed has already done that. And then we're also going to do the head circumference right above the eyebrows and the chest circumference. Next, we're going to look at general and overall appearance. My baby is active, crying, wee, wee. Eyes are open and responds to stimulation very well. APGAR scores were 8 and 9. I'm going to look at the baby. Baby appears to be symmetrical. Everything appears to be, muscle tone is good. And we're also going to be looking at the skin. Looking for vernix. There are tiny milia bumps on the baby's face, which is normal. Minor lanugo has been seen. No erythema toxicum. No Mongolian spots. For Mongolian spots and skin assessment, we are going to ensure that we flip our baby over safely and check especially the back and of the legs and the back. Skin does appear to be normal, so we're going to lay our baby back over. Our baby does not have a diaper on right now, so that we have easy access. We are also noting that we do not see any petechiae at this time, and now we're going to move on to the head. The head is normocephalic, as you can see. We can assess the fontanelles, both the anterior and the posterior, very carefully. Neither appear to be bulging or sunken in. Sunken in could mean that the baby is dehydrated. There's no abnormal molding, no cephalohematoma, and no caput suicidum. The face is symmetrical, and tiny milia was noted as previously discussed, which is normal. Eyes are slate blue, which is normal. They usually will change within a month. Perla established. No strabismus. Conjunctiva is pink and sclera is white. No jaundice notes here. From looking at the top of the ear to the corner of the eye, they are even and symmetrical on both sides, which is great. I'm going to put my finger under the baby's nose to feel for air, because babies are obligatory nose breathers, and I do feel patency in both nostrils, which is good. Next, we're going to go down to the mouth. I need to ensure that I put my finger in the baby's mouth and check the palate every time I do an assessment to ensure safety and that nobody misses anything. I'm feeling the top and I can feel the palate. I don't feel any Epstein's pearls. Suck appears to be within normal limits, very strong, and I've already established a good swallow as mom breastfed. Now I'm going down to the neck and clavicle. Very small neck. Clavicles do not appear to be broken from birth. Next, we're going down to the chest. The appearance is symmetrical. The shape is normal. Nipples are slightly engorged, which is within normal limits related to mother's hormones post-birth. This will go away, and we will ensure the parents of that if they are concerned. Size appears to be 1 to 2 millimeters, which is normal. No extra nipples found. Breath sounds, we're going to listen for breath sounds, and they should be between 30 to 60. It is normal to have apneic periods, up to 15 seconds. This is normal in baby breathing. Apical rate, we are going to ensure that we auscultate, for 60 seconds, and it should be within 110 to 160 beats per minute. We're going to assess this pulse apically for 60 seconds. Time starting now. 58, 59, 60. It has been 1 minute. We appropriately assessed the apical rate, which was 60 seconds. It was at 120, which is within normal limits. I did not hear a murmur, and that would have been normal if I did within the first 24 hours. I've also listened to breast sounds on the front and the back, and I have ensured that there are no crackles, although that would be normal within the first 24 hours of birth, longer if there were a C-section. Now we're going to inspect the abdomen. The abdomen does not appear to be distended. Baby has had their first bowel movement. I'm going to ensure to auscultate. And we do this in the same manner that we would do an adult. Bowel sounds are normal. The patient has passed gas, has voided, and has had a meconium since birth. Looking at the umbilical cord, we do see two arteries in one vein, and this should dry within 6 to 12 hours. I don't see any redness and no abnormal discharge. Next, we're moving on to the genitals. If this patient was a female, we would look for any discharge. Sometimes the newborn baby girls will bleed a little related to female hormones. This is not the case for our patient. The labia appears to be covering the clitoris, and I don't see any urate crystals. If this was a male, we would look at the tip of the penis to make sure that the meatus was central and no epispadias or hypospadias. Next, we would go down to the testicles and feel, and we see some rugae, and the testes are descended, and I don't feel any cause for concern. The rectum, we're going to lift the baby's leg up, and we're going to rub our finger across the anus, and we will look for the wink reflex, which we just saw, and that ensures that we already have had a meconium, so we're okay there. Next, we're going to go on to extremities. We're going to ensure that they are equal in bilateral movement. Muscle tone is very good. We've already established that. We're looking for 5 fingers on each hand, which we see, and we have 5 toes on each, which is great. Next, we're going to establish, range of motion, making sure we're good. We're looking for hip dysplasia, which can happen after birth. And then we're also looking for club feet, which we do not see on this baby. Everything appears to be within normal limits with extremities. Next, we're going to look at the back and the spine. The vertebral column alignment looks wonderful, and there are no openings, no injuries that we can see. And we've already established that the anus is patent with the wink reflex. Next, we're going to go to baby reflexes. We're going to do the Moro first, which is where we lift the baby up slightly with butt sitting on the bed. And we're going to pretend to drop very ever so slightly, and we will see the baby be startled. And the baby was startled, so that is good. The tonic neck, which is when we have the baby look this way, arm goes up, same with the other side. Very good. Palmar, which is when the baby grabs, perfect, baby grabbed my finger. Wonderful. Next, we're going to go down to the feet and do the plantar, the big toe extended, which is great. And all the feet went out as I did the Babinski reflex, which is good. Next, we're going to check the rooting reflex, which is where we touch the cheek and the baby follows, which is exactly what happened. Sucking, we've already established by sticking finger in the mouth. We'll do it again. Wonderful. Swallow, we already established while mother breastfed. Now we're going to do stepping. This is where the baby, when you hold them up, they will start to step. Very good. Baby's looking really good. The only reflex that we have left is the trunk incurvation, because we already did the Babinski. So if I rub aside, you can see that the baby curves with that rub. Which is good. We've already established that the behavioral state is very good. She's active and alert. She's not intensely crying, which is good. So we will consider her active and alert. and we have no further concerns. This is the end of the assessment.